I'm not arrogant enough to say that I have the answers to that. A lot of really smart people in the last 2 years have made a lot of predictions, and almost all of them have been wrong. I remember last year, some really smart people saying, well, the pandemic will be over and we'll be endemic in April of 2021. Well, it's now January of 2022, and that's not the case. So the hope certainly is that as Omicron comes through and so many people have had it, many people have been vaccinated, many people have been vaccinated and had it, that will give us some degree of herd immunity going forward, and that the next variants that come will be variants that, while they may be contagious, don't cause as severe a disease. And then we move into that endemic phase. So we're no longer pandemic, where we get these big surges, but more endemic, where the virus is around, much like influenza, and we manage it as a society. The wild card in all of that is, will a variant emerge that our current immunity from vaccination or having had COVID doesn't address? And if that's the case, we can still have pandemic phase going forward, but hopefully, obviously we hope that's not the case and we can move into a different period. I'm also hopeful, as newer antiviral agents come to market, like Paxlovid and Molnupiravir, and monoclonal antibody supplies ramp up, that we'll have more effective treatments that will help keep the burden out of hospitals going forward. And so I think the message is out there. I think people know, even though the science has had to evolve and change and the advice has changed, I think in general the same concepts are still out there, which is vaccination with a booster is your best chance of avoiding severe complications from COVID, which include hospitalization and death. We know that in closed spaces with a lot of other people who don't have any immunity raises your risk of getting COVID. To your point, I think in general, American society is tired of the messaging, and many groups of people have simply moved on. So it behooves us in healthcare to have to understand that dynamic and make sure we have the resources available to care for patients who have complications related to COVID. And I think that's just kind of where we are. And I think people kind of know what they need to do, and obviously they can choose to do that or not do that. And then in healthcare, we have to deal with the downstream ramifications of those decisions.